Welcome to another episode from the Veterinary Research Channel. Today, we're exploring an in-depth study that investigated a new approach to tackle anemia in cats suffering from chronic kidney disease, a common and challenging condition in feline medicine. The study focuses on the use of Molidustat, a drug that could offer a safer, more effective way to manage this prevalent issue. Introduction to the problem. Anemia is a frequent complication in cats with chronic kidney disease, CKD, affecting a considerable percentage of these patients. The kidney's declining function leads to reduced production of erythropoietin, a hormone essential for stimulating red blood cell production. Current treatments often involve erythropoietin replacement therapy. However, this approach is not without risks, as it can lead to severe complications like hypertension and pure red cell aplasia in some cats. Therefore, finding safer and more effective treatments for anemia in cats with CKD is critical. The Molidustat solution. This study, a collaborative effort conducted across multiple veterinary centers in the United States and Europe, aimed to evaluate the safety and effectiveness of Molidustat in stimulating red blood cell production in anemic cats with CKD. Study design and methodology. The study was designed as a multi-center, randomized, double-masked, placebo-controlled field study. This design is crucial for minimizing bias and ensuring the reliability of the results. Client-owned cats diagnosed with anemia and CKD were enrolled in the study. To be eligible, cats had to be at least 1 year old, weigh at least 2 kilograms, and have a packed cell volume of no more than 27%, which is indicative of anemia. They also needed a serum creatinine concentration greater than 1.8 milligrams per deciliter, a marker for CKD. Cats were excluded if they had certain other conditions or treatments, such as urinary tract infections or previous treatment with recombinant erythropoietin. The enrolled cats were randomly assigned to one of two groups: a treatment group receiving Molidustat or a control group receiving a placebo. The treatment was administered orally once daily for 28 consecutive days. Throughout the study, various parameters were monitored, including hematocrit levels, red blood cell counts, and overall health. Hematocrit, HCT, and packed cell volume, PCV, responses over time with a primary clinical endpoints. The science behind Molidustat. Molidustat is a hypoxia-inducible factor prolyl hydroxylase, HIF-PH, inhibitor. To fully appreciate what this means, it's helpful to understand the normal physiological processes it affects. Under normal oxygen conditions, HIF is degraded by HIF-PH enzymes. However, in the kidneys of cats with CKD, decreased metabolic activity leads to relative hyperoxia, which accelerates the degradation of HIF, reducing EPO production. By inhibiting HIF-PH, Molidustat prevents the degradation of HIF, which in turn boosts the production of EPO and subsequently increases red blood cell count, thereby alleviating anemia. Expert opinion. To provide additional context, here's an expert opinion, veterinarian. Molidustat represents a paradigm shift in how we approach anemia associated with chronic kidney disease. Rather than directly administering erythropoietin, this drug stimulates the body's inherent mechanisms for producing red blood cells. This approach may lead to a more natural and sustainable response, potentially mitigating some of the risks associated with traditional erythropoietin therapy. Dosage and administration. Throughout the 28-day treatment phase, the owners administered the medication. The Molidustat was given at a dosage of 5 milligrams per kilogram. Data collection and analysis. Throughout the study, data was collected during visits on days 0, 7, 14, 21, and 28. Technicians recorded body weights during each visit, and blood was collected to assess hematological parameters. Blood was also collected to evaluate serum biochemistry on days 0 and 28. The data collected was subjected to rigorous statistical analysis to determine the effectiveness and safety of Molidustat. The primary outcome measured was the change in hematocrit levels over time. Study results. The results of the study revealed that cats treated with Molidustat showed a significant increase in mean hematocrit levels compared to baseline. Specifically, the mean hematocrit in the Molidustat-treated group increased weekly, with a significant increase compared to baseline observed on day 21. On day 21, the mean hematocrit in the Molidustat group was 27.3% compared to a baseline of 23.6%. In contrast, the mean hematocrit in the control group remained low throughout the study, ranging from 20.1% to 23.4%. By day 21, the difference between the two groups was statistically significant. However, by day 28, the difference between the control group and the treatment group was not significantly higher. Even so, the number of cats who experienced individual treatment successes was higher in the Molidustat group. Adverse events. It's important to consider the potential adverse effects associated with Molidustat. In this study, the most frequently reported adverse event was vomiting, which occurred in 6 of the 15 cats in the Molidustat group. Additionally, there were 3 serious adverse events reported during the study. 1 cat in the control group died due to respiratory distress. Of the cats in the Molidustat group, 1 was euthanized due to end-stage renal failure, and another was euthanized due to lateral recumbency with a cold front leg. Study limitations. The study authors acknowledge several limitations that should be considered when interpreting the results. These include the small sample size, lack of CKD staging at baseline, use of different laboratories for clinical pathology assessments, and missing data. These limitations highlight the need for further research with larger and more diverse populations to confirm these findings and fully elucidate the long-term effects and safety profile of Molidustat. Conclusion and implications. Despite its limitations, this study provides valuable insights into the potential of Molidustat as a novel treatment for anemia in cats with chronic kidney disease. The findings suggest that Molidustat can effectively stimulate red blood cell production in these cats, offering a promising alternative to traditional erythropoietin replacement therapy. As veterinary medicine continues to advance, studies like this underscore the importance of innovation and collaboration in finding better ways to care for our animal companions. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.